Welcome to Sonia Podcast. On my podcast, because we are still in February, I'm still going to be talking about relationships in Black history. So let's get into it. Oh my God. People, like I tell y'all, people send me so many things. And I find some of them to be very, very interesting. I came across one and I found this to be interesting. There was an article, I think this is an article she sent me, and it was like, why the U.S. desperately needs more Black doctors. And I never really thought about this, I guess I didn't really have a reason to think about this, but it says only 2% of active physicians are Black women, and they come with some very real consequences. So let's dig into the great benefits of Black providers and how you can help drive. Heather, a board-certified OBGYN in New York, knew she wanted to be a doctor since she was a child, about the time her experience of racism began. Graduating top 3 in her class from high school, she was urged by school officials and others not to apply to certain colleges because she wouldn't get in. She applied anyway in college, and she was told not to pursue medicine because it wasn't for her. She went after it anyway. Throughout her career, there's always been this segment of, I don't think that's for you, with no real reason, so is why, as to why it's not for me, said Dr. Heather. Statistics would suggest that the reason was because she's Black in the United States. Just 5% of all active physicians are Black, and just 2% are Black women. The medical community is, in short, solely lacking in diversity, and the instances of racism in the medical field aren't always present as the microaggression Dr. Heather experienced. The prejudice and misunderstanding go much deeper. For example, half of the white medical students and residents actually believe Black people have thicker skin or less sensitive nerves ending than white people. According to a study published in the Proceeding of the National Academies of Science, perceptions like this can be incredibly damaging to the care that Black patients receive, not to mention further the systematic racism that already exists in the industry. In some studies, Black patients report less time spent with providers, reduced patient-centered care, and reduced shared decision-making during the appointment, all of which have a direct effect on patients' outcome, explained Nadine J. Barrett, Ph.D., Director, Office of Health, Equality, and Disparities at the Duke Cancer Institution. Dr. Heather seconded this with her personal experience. For example, she says she overheard doctors suggesting Black women care more about their nails and hair than their health. And in medical school, she remembered a doctor telling students that radical groups display pain differently. Then there are the blank examples of racism doctors themselves face. For instance, a few years ago, while working in a upstate New York community, Dr. Heather had a white patient refuse her help because she's Black. They didn't think I was good enough, and that was before I even rendered them care, she said. They saw me and they said no. Leadership at the clinic didn't back her up. The patient was switched to the care of a white provider. Then Dr. Heather went home and cried. People don't realize how much that hurts, she explains. This is who I am. I was born with this skin. The truth is the benefit of Black doctors and healthcare providers are enormous, and a lack of them, as well as the racism that pre-medicine is a monumental issue with serious ratification. Here's just a glimpse at the rip effect of a mostly white medical field explained by Black voices in the field, plus what you can personally do to push for diversification in the medical industry. The consequences of a lack of Black providers across the board. Statistics don't bond well for the health and well-being of Black Americans. Black women have the highest maternal mortality rate during pregnancy and postpartum, are more likely to suffer from pregnancy-related complication and death. Historically speaking, the obstetrician and gynecology field in particular is plagued with experimental surgeries done on enslaved black women without anesthesia, contribute to a general distrust and provides among black patients. So, as we continue, because we're going to continue, she's going to go in further and telling, like, there's 11 ways black women can protect their mental health during pregnancy and postpartum. She's also going to explain the black community is more likely to experience mental health disorders such as aggressive and potentially life-saving therapy. She's also going to explain that medical education, is always trying to find a very objective reason for why disease happens or why outcomes are poor in certain groups of people. She also explains that in her medical education, she was taught that the reason poor health outcome exists in black people are in large because of genetics. But when you start looking into the social science research, you realize that they actually are not really true. And that is a lot to do with health disparity instead. And a lack of black providers had lasting consequences on the disparity that already exists. One of the most possible consequence of a lack of African American providers is African Americans not seeking service because they are unable to find someone who looks like them or who they feel can connect with them. Said Rachel Wicktaker, LSSP, LPCS, an educational psychologist at Preventional Counseling and Consulting Service, PLLC. In mental health specifically, she notes many African Americans do seek out service from practitioners or other race only to feel unheard and stereotyped. This can be enough to cause someone not to seek help again, she notes. Accessible and supportive mental health resource for black women. This implicit bias in medicine is even more apparent in specialty fields such as oncology, where all black providers make up just 2.3% of doctors, said Monique Gray D.O., a breast surgical oncologist and medical director of the cancer program at Grandview Health Penn Cancer Network. As a result, black patients may feel more isolated and less trusting of the care they are receiving, explained Dr. Gary. They fear being experimented on by medical establishments, she said. Hysterically and arguably, currently, the healthcare system is not always a trustworthy place for black patients, as Barrett. And if you have a doctor who you feel like you can't effectively communicate with, that can erode trust and intrude the opportunity for a black patient to openly discuss their health and priorities, both critical elements of good care, she explained. This is all extremely relevant in mental health care as well. When implicit bias take over, its non-black providers is negatively affect the care that a patient gets. Still, an even more alarming concern is what happens when there are not diversity at the top, where decisions are being made. While she's been actively addressing the racism and disparities in the healthcare system during conversation she had with decision makers, she knows she's not able to be oppressed every time it matters. What if I wasn't there, she said. If there aren't people with different opinions who come from different backgrounds, certain thoughts get perpetuated and become free-flowing. There's no one there to check it. Dr. Gary adds, wherever there is a paucity of diversity at the top, the pipeline too suffers from downstream effect of that lack. Now, how racism affect your medical health. So they go on to say that the great benefits of black doctors based on internist at YUN Longo Medical Center said the joy and excitement she felt from black patients when she introduced herself as a doctor. Their faces light up because they know that there is someone present who can better relate to them, empathize with their struggles, and is willing to work harder to reduce the healthcare disparities that currently exist. Experts agree that black providers are a critical piece of the puzzle in reducing black health disparity. Black patients who receive care from Black doctors report greater trust, better communication, perceive less bias than those who see non-Black providers. Studies show that these interactions are longer associated with more positive effect and satisfaction. Overall, higher quality doctors-patient interaction lead to better health outcome for everyone. For them taking their meds, following up on their care, having understanding of what they like, what they don't like. Black providers often benefits that white providers simply cannot. Black mental health providers specifically can provide an environment of trust, openness, where someone could discuss racism, prejudice, stereotypes, cultural competence. Clients may feel a sense of community where some things don't have to be explained. On top of a wealth of professional experience, the professional experience of Black providers may resonate with Black patients. So in her personal experience, Black patients have considered me as their daughter. I became a trust advisor to help them navigate their overall health outside of their cancer, said Dr. Gary. I have personally had Black patients begin to cry with grief, yes, but also with relief that a Black cancer surgeon will be rendering their care at a time when they fear most for their lives. When represented in leadership roles, Black providers provide diverse perspectives to the decision-making table of healthcare facilities, which directly impact health outcome. Dr. Heather recalled pregnant patients who have come to her crying, afraid that their baby health or their health will suffer at the hands of the medical system. They say, I trust you to be able to understand me, but you can't sit in the room with me the whole time. She says she heard these concerns, and to this extent suggests that one of the biggest benefits of diversity in healthcare is having voices who can make changes at all levels of the system, making sure there are diversity training and other structures in place to address their radical issues. When represented in leadership roles, Black providers bring diverse perspectives to the decision-making table of healthcare facilities, which directly impact health outcomes, explained Ms. Dr. Barrett. In short, diverse radical representation matters more than you think. It does make a difference to those individuals that there's a healthcare provider who looks like them, said Dr. Caddick. It gives patients hopes that the world is committed to providing equitable healthcare for all. So how can you create change in the medical community? The topic of getting more Black doctors into the medical field and doing away with the systematic racism that exists there and elsewhere feels like a big one, and it is. Still, there are ways that you can enact change, even in your day-to-day life. If you're a Black provider, volunteer in school program in the local medical schools. Young Black children and aspiring doctors need to see healthcare professionals who look like them in order to know that this is a route available to them. After all, it is hard to picture yourself doing something if you don't have many examples of people who look like you doing it. Ask about representation. Ask your organizations, alumni, or local hospitals and specific steps that will take to increase minority representation. Now is the time when leaders across all industry, especially healthcare, are listening, said Dr. Gary. Get their response and hold them accountable, she said. Remember, your singular voice have power. Your story, your voice, your concern matters to Black women. And once you find that voice, use that pen. Type that letter, leading to being a beacon of change right where you are. This is how movements begin. Support STEM programming. We need to encourage more minority students to consider careers in STEM fields and mentor them, said Dr. Gary. We can become more international about introducing young Black girls to the science and medicine, add Barretts. You can get involved by donating, volunteering, and supporting groups like Black Girls Do STEMs or Girl Pursuing Science to help that cause. Oh, thank you. This was interesting. I be thanking my supporters. They give me some good stuff. And I'd like to thank you for listening to Sonia Podcast. Please get a 5-star on Speakers, iBeam, Apple, iHeart, wherever you listen to your podcast, please share. You can call me at sv76672@gmail.com. Go to my website, http://wordpresses.com. Go to my son's, follow him on Instagram. He have an album out, Sounds. He have an album out on Apple, Spotify. Follow Miss Carr. She have her own affirmation. Follow TJVULCAIN. She have a book called Black Girl in Orange. King Flex on SoundCloud. Female Reform. They have a venture store in New York. You can follow me at SON.IA9795. Instagram, Sonia Santiago, Twitter, Facebook, YouTube, Pinterest. And have a blessed night.